When you look at the rollout of the vaccine, a number of questions on whether the U.S. and other parts of the world, including Europe, are too slow. What can you tell us about what you're actually seeing on the ground?
It is something that's very slow. It started with kind of a trickled pace at the end of December, but it is starting to ramp up. And I think it has to do with a lot of logistical issues that states were very wary to really jump ahead quickly, not knowing what their supply chain would be, not knowing what the percentage of people who had allergic reactions were, and really trying to stick to the priority groups as best as they could. And I think that's sort of served as an obstacle. And now we're seeing them get much more flexible and comfortable doing it. But again, we're still far behind where we need to be. We're not at the rate of Israel. We're not at the rate of the UAE. And I think if we're going to stay ahead of this new variant and put this pandemic behind us, we have to significantly ramp up the speed, and we have to have a lot of security around how many doses are going to come so that states can safely give people doses because they know more are coming, so that they don't have to continue to kind of start and stall.
What can you tell us about, the vaccination rollout and the fact that we could still see, even if you're vaccinated, asymptomatic infections?
This is a bit of a controversial topic in my field, and we're trying to understand the answer to this question. We know the vaccines are very effective at preventing symptomatic disease, and they likely reduce spread. But how much do they reduce spread? Is it 80%? Is it 70%? Is it 60%? Because that's important for the guidance that we give people after they're vaccinated. So right now, if you've gotten 2 doses of vaccine, we don't change the guidance, but we know that those people are less likely to be asymptomatically infected, but we don't know how much. And I think this is an urgent need to really do research to understand how protective are they. And many vaccines do protect against not only symptomatic infection, but asymptomatic infection. And the other point is, as more people get vaccinated, it becomes less and less important about this asymptomatic infection because the virus is designed to stop severe disease from occurring. And if everybody is protected, even if they get an asymptomatic infection, it's not going to matter because no one is going to land themselves in the hospital with COVID-19. But again, this is something we have to figure out so that we can give people the right public health messaging.
Yeah, in the UK, I mean, the experiment seems to be you vaccinate as quickly as possible with the first dose, but you actually wait up to 12 weeks to give the second dose. Is this as reliable as the trials in which actually the 2 doses were much closer?
We don't know because there was never a trial where they waited 12 weeks. All the trials had this 3-week interval for the Pfizer vaccine and the 4-week interval for the Moderna vaccine. We do know that if you get your second dose, then you're going to get the protection. But how long will that first dose's protection last? So as you get closer to that 12-week mark, do you have much residual protection from the first dose? And that, I think, is also another question. We don't have data. I understand why the UK did it, and I do think taking the second dose late is better than not taking it all. You don't have to restart the series if you take your second dose late, but you're going to have some period of time where you're probably not as protected as someone who got their first and second doses on time. But in an emergency situation, I think we can't let perfect be the enemy of the good. And if this is an issue of trying to stay ahead of that variant and try to vaccinate as quick as possible, I think it's a reasonable approach. But I would like more data to be able to be confident that it's not going to have any deleterious effects.